Well, there are a number of components for which anyone should be concerned, primarily the genetic components of an addiction. For sure, the genetic components of a mental health or mental illness issue is about 60%. If someone in your family has an addiction, and as you're growing up, you have the opportunity to observe that addiction or participate in that addiction, if both mom and dad have the addiction or addicted, let's just say simple alcohol, and they drink every night, then part of your growth and development is going to see that drinking is a component of what it is that people do. That then can be a learned behavior in addition to a genetic behavior or genetic predisposition. Then drinking can also be a learned behavior. Consequently, at that point, I think the concern that a parent should have is the age of onset by which someone begins engaging those activities. And it's pretty common nowadays for young kids to explore 12, 13, 14 years of age, and what the impact of that use of a substance is, especially given that mom and dad are using. So I think parents should be concerned. I think children should be concerned with the potential for developing an addiction to a substance, especially if there's a genetic predisposition and parents actively use those substances in the home. Now, just because your parents have an addiction to alcohol does not necessarily mean that there's a direct correlation. It certainly increases the probability. The other option is because you have witnessed your parents having a substance abuse disorder or have an addiction to alcohol, that may have forearmed you to be wary of the impact that this might have on you, and steer clear of engaging those types of behaviors that you've witnessed your parents doing. At the same time, we still have the genetic predisposition to do that. Just, I believe, an increased awareness of the potential of what can happen to you, not just with a substance abuse disorder, but also with other mental health issues, whether it's anxiety or depression or something else. I think people should be aware that a mental health evaluation might be appropriate to see what the potential is for a person to develop that and become a patient in the clinic.